thank you, number one, for the sacrifice that actually you have made. All protocols observed, our president and the CEO. I know it has not been easy for us to be here for almost 5 days. It has taken a lot of sacrifice, a lot of disorganization, the place of work, and actually a lot of budgeting. So I want to claim for yourself. I'm a hero. So the next thing I would request you, before I just say something, would you accept kusimama tu kidogo tu, just for 1 minute, then we do something, then we sit down. By the grace of God. Now I think you can stand. So if you have your phone, I wanted as we go to our members forum, the one for our conference here, the WhatsApp group. If you don't have bundles, you can freezer kidogo. So that then once you are there, there's a form that we need to give feedback. I want us just to say, where are we going to be the next conference? I know some of you have not given feedback, and we want actually to have feedback as PSK. So if you are through, you can sit down. Please, I know those who have done it. So no, there is hell and heaven. So please don't sit down. So I want the seniors, our fellow seniors, you can have a seat. I don't want you to keep on studying. So thank you, Doc. Please don't sit if you have not responded. Has not been rooted. Don't say that, we'll sack somebody. It's there, I can see it there. Isn't it? Dr. Diambo, yes, it's there. So if you want us to go to Kisumu, we go there. You want white sons who marry Mahasura or Mezoya Uko. Now you have this problem is a problem with the people at Jazoya South Coast. So, so we want to be sure. We don't want to do voting when we go back to Nairobi that this venue we didn't want. So we want to do it, all of us. Are we through? So thank you, colleagues. You can have your seat. And so mine is only 10 minutes. I don't need to take a lot of time. And I want to appreciate our young pharmacists, number one. We have been working closely with them as PSK and as the Vice President for Pharmacy Practice in Kenya for PSK. Dr. Diambo is a very good man. We have been working together. Dr. Bedwell, Cohen, majority of them. And they have good ideas and brilliant ideas. PSK is very cognizant about those young pharmacists who don't have jobs. That is our priority. And last year when we had some of them posted and they didn't get places where they can be placed, we really followed it up with a lot of seriousness, and actually we succeeded. So I think we thank God for that. Now, you know the problem that we have about pharmacy practice in our country. And these three offices, the Vice President Governance, Lobbying, and Practice, they are new offices in PSK. And I know members will decide how they will be formulated as time goes. So we are trying to look at the gaps and actually see what we can do. So these are the roles for our PSK society. The next slide, Doc. Ezron. The other one, we know this one, just go down. Now, we need to understand or to remind ourselves the role of a vice president as far as practice is concerned. And the vice president is not voted. It's not by vote that you say you didn't vote for me. No, it is through interview, through NGC. So these are responsibilities that have been given. And one is about ensuring that Green Cross, some of us who are pharmacists and they're running community pharmacies, including government hospitals, we are directing every pharmacy in this country, if it's managed, supervised by pharmacists, to have Green Cross put there. So we are coming up with modalities and how to rebrand Green Cross so that we actually be able to sell it to members, and not only to members, even to the country, to the policy makers, with a brand of quality, safety, and professionalism. The other scope, the other work that I'm being given is about the scope of practice. And I think this is what we are discussing when the issue of curriculum came up the other day. I think in Kenya, the scope of practice that we have pharmacists in town. And then we have the pharmacist. And then we have the consultant pharmacist. So we are trying to discuss, all of us, with the PPB to see whether we are going to introduce subspecialties in pharmacy practice. And you know, if we don't do that, we have KMTC now introducing higher diploma in oncology, in pediatrics, which actually they are coming, okay, after higher diploma in clinical pharmacy. And you see, these are some of things we started talking long time ago, almost 2009, about subspecialty, and presented several options to PPB. But now you see, if we don't move that direction now, we are all sure that KMTC will move to that direction. The way we have clinical officers having all these subspecialties. Now, the scope of practice that we have is actually what should now form the issues of curriculum review that we were having the other day. And now we are actually in total discussion with the PPB, and we promise to update you on every gain that we are going to arrive at, both of us. It is under this scope of practice, again, we are trying to look at the issue of quacks, the one that was mentioned the other day. You remember as PSK, we suggested to PPB, we have met with some of the officials that we would prefer inclusion of sub-county pharmacists to oversee some of inspectory roles within their jurisdictions. And I think probably the chairman yesterday talked about it. And even after meeting with PSK, I think we are going to achieve that. And you know what that is going to do? It's going to create a lot of opportunities for us who want to venture into retail practice. Because sub-county pharmacists, they know the areas very well. And they are able to work together with the PPB, inspectors, and be able to make sure public is safe from illegal outlets. So, about mainstreaming MTM. Last year, we did a training for MTM sensitization with the entire PSK leadership. And did you know we had like 567 pharmacists who were interested to do the course? Unfortunately, some of them were not PSK members, but they're pharmacists, legally registered pharmacists. So we ended up training like approximately 200 pharmacists. And I think some of us who attended the training, it was very, very good. And now, what next from there? As PSK, we want to start pilot. We want to start pilot actually the next few months, 3 to 4 months. And we have facilities that we are going to sample so that now we can roll out MTM or medication management process implementation. And I think by December, we are going to have data that we are able to present to governors and everyone else who thinks or who believes that pharmacists don't have value. We are going to demonstrate in terms of economic outcome, therapeutic outcome, and actually socialistic outcome in terms of the objectives that we are going to put. We are expecting by the grace of God, we will fund the people who are going to do the pilot up to the completion of the few months. We expect to do this in 47 counties, and we may have maybe like 1 level 4 hospital and 2 community pharmacies, because we want to run both the hospital setup and the community pharmacy. So what else? We have pharmacy practice bill. I think we are through with this bill, but we have not shared with you. And we agreed that we want our bill to go hand in hand with the KNDA bill if in a case that is the way that we are going to decide. So the bill is there. So when it's appointed time, we are going to share with you, and then we are going to have input. Because the bill is for members, it's not for PSK leadership. So any other slide, Doc? Yes, Ron. You know, we have hassled with you severally, because treat. So now this is where we want to take pharmacy. And please, because I understand pharmacy practice in Kenya very well, okay? So both from regulatory, where I've worked, both to marketing, where I've done marketing and repping, both to community, both to public, where I'm a MH now and the men soup, fighting with the crisis every day. That's why it's easy to manage you. So this is where we want to go. We want to bring pharmacy practice to a level that you own the patient. And I want us to be attentive. If we don't own the patient, the question of why should I have pharmacists? That is why everybody is talking about that. Everybody is talking about that. I asked my leadership in Kiambu County, you give me drug worth 2.6 million, but there's no pharmacist to oversee accountability and theft. Who are you going to ask? So these are the areas you want to move. We move from, where's these things? We move from patient, we start from patient relationship. This one can develop at the window, probably. Then we start now showing value. The level of showing value to patient is to tell him, why are you having headache when you take this drug? You explain to the patient. That is value as a pharmacist. Why are you having nausea? You start demonstrating value from the knowledge that you have. The moment you demonstrate value to the patient, you own that patient for the rest of your life. And when you own patient, you also make sense in terms of economic value. So the whole idea of MTM, medication management, medication optimization, desalinization, all those things, we want to start owning patient. And remember, please, I want us to understand the medical doctor, the dentist, and the pharmacist. They have equal responsibility to the patient. I don't know whether you understand it. Whether it's a physician, whether it's a medical doctor, or a dentist, or a pharmacist, we all have equal responsibility to the patient. There is no one who is lesser than the other. And this is the problem we have when somebody thinks that the pharmacist is not privileged to some of the right for the patient. As far as the law is concerned, we have equal right. And I think that is the beginning of now where we want to bring our service model to the patient. Is there anything else? So, in this, okay, that one I've said. In this service model, we want to bring it to the community pharmacy. How do we want to run our community pharmacy? The community pharmacy that you run, we want it to be one clinical experience center. Number two, we want it to be an IT technology center, the same pharmacy. Number three, we want it to be a research center, the same community pharmacy that you run. Why are we doing this? Because we want you to get a grant to do all these things you are talking about. So, anything else? So now, I've just mentioned about subspecialty, and we know them, all of us, and I think we move that direction. Now, how do we do this, colleagues? I think the first thing we must learn how to engage ourselves. Instead of quarrel, let us engage each other. Are we together? That is the most important critical thing. And the moment we learn engagement among ourselves, then now we must align ourselves. And I think PSK is doing a lot of work, even if there's no money, to make sure that we align ourselves to the direction of changes. Then the last thing that we need to understand, if we achieve these two, development is about self. It's not about PSK. It is about individual pharmacists to say, I want to venture in this area. I want to be an expert in this area. And you see, this is what I was saying to the young pharmacists, that the moment you decided to go to farm school, your mind about pharmaceutical technology should be out of your mind. We have to change mind. The moment you say, I'm going to farm school to become a pharmacist, you knew their farm text, you know their blah. If you found people driving Toyota and you want to buy TX, you don't think about Toyota again, isn't it? So the moment you come out of farm school, you are a pharmacist. And your level of thinking and practice can never think about a farm tech, whatever the case, if at all you have gone through farm school. So I think we changed that so that now we are able to get what? Self-development. And I know we are going to achieve that. So as far as pharmacy practice is concerned, we know there are areas we need to implement. 90% of our problem is implementation of regulatory affairs, isn't it? The laws that we have, it is the 90% problem we have. So PSK, we are working towards to ensure with PPB, what is this that we have not implemented? 1, 2, 3, 4. Then we see our young pharmacists, they are placed in these areas. And when you see some of the findings that we are doing with young pharmacists, don't think they will stop. We'll bring another one after this conference, which may even touch your place. So we want to see the areas that we need to implement regulatory things, and then we are able to place our colleagues. So colleagues, thank you so much.